Hello everyone. Today we are going to talk about something very important. It is a device called an AED. AED stands for Automated External Defibrillator. That sounds complicated, but it is not. It is a smart medical machine. It is small and portable. You can find it in many public places. This machine can help save a life. It is truly a lifesaver for many people. Knowing about it is a great first step. So, what does an AED do? It helps when someone's heart has a problem. Sometimes a heart can stop beating normally. This is called sudden cardiac arrest. The heart's electricity goes wrong. The AED can give a special electric shock. This shock can help the heart. It can help the heart beat right again. This is a very important job. It gives someone a much better chance to live. Why is an AED so important? Because time is everything. When sudden cardiac arrest happens, every second counts. Waiting for doctors can take too long. The brain needs oxygen from blood. If the heart is not pumping, the brain does not get oxygen. An AED can be used by anyone nearby. You do not need to be a doctor. The machine guides you. This quick help can save a person's life before help arrives. You might see AEDs in many places now. They are in schools and airports. They are in shopping malls and gyms. Look for a sign that says AED. It often has a heart with a lightning bolt. Knowing where the closest AED is can be very helpful. If an emergency happens, you will know where to find it quickly. This knowledge can make you a hero. It empowers you to act fast. More AEDs in public means more lives saved. Let's look at an AED up close. It is designed to be simple. Most AEDs have a few main parts. There is a power button to turn it on. There are special sticky pads. These pads are called electrodes. You put these pads on the person's chest. The AED also has a speaker. It talks to you. It gives you clear instructions. Some AEDs have pictures too. These pictures show you what to do. It's made for anyone to use. How does the AED know what to do? It is very smart. After you put the pads on, the AED checks the person's heart. It analyzes the heart's rhythm. It can tell if the heart needs a shock. It will not shock someone if they do not need it. This is very important. It makes the AED safe. Only if a shockable rhythm is found will it prepare to shock. This intelligence is built right into the machine for safety. The pads are a key part of the AED. They usually come in a sealed pack. Inside you will find two pads. The pads have pictures on them. These pictures show you exactly where to place them on the bare chest. One goes on the upper right side of the chest, the other goes on the lower left side, under the arm. The pictures make it easy. Even if you are nervous, you can follow the pictures. Make sure they stick well to the skin. The best part is the AED guides you. Once you turn it on, it talks. It will say things like attach pads to patient's bare chest. Then it might say, analyzing heart rhythm, do not touch the patient. It tells you every step. If a shock is needed, it will tell you to press the shock button. It will even tell you when to start CPR. Listen carefully to the voice. It is like having an expert right there with you. Okay, let's learn how to use the AED. Imagine someone has collapsed. They are not breathing. First, make sure the scene is safe. Then call for emergency help right away. If an AED is nearby, get it. The very first step with the AED is to turn it on. Find the power button. It is usually green. Press it. The machine will start talking. It will guide you through everything. Listen very carefully to every word it says. Next, you need to prepare the person's chest. The pads need to touch bare skin. Open or cut the person's shirt. Quickly wipe the chest if it is wet or sweaty. The pads will not stick well to a wet chest. If the person has a lot of chest hair, it might stop the pads from sticking. Some AED kits have a small razor. You might need to quickly shave the areas where the pads go. This ensures good contact for the AED to work. Now it is time to attach the AED pads. Take the pads out of their package. Look at the pictures on the pads. They show where to put them. Place one pad on the upper right part of the person's chest. This is usually below the collarbone. Place the other pad on the person's lower left side. This is often on the ribs, a few inches below the armpit. Press the pads firmly onto the bare skin. Make sure they are stuck on well. After the pads are on, the AED takes over for a moment. It will say something like, analyzing heart rhythm. Do not touch the patient. It is very important that no one touches the person. The AED is checking if a shock is needed. If a shock can help, the AED will tell you. It will say, shock advised, charging, stay clear of patient. Then it will tell you to press the shock button. Before you press it, shout, clear, to make sure no one is touching the person. Then press the button. Safety is super important when using an AED. The most important safety tip is this: Do not touch the person while the AED is analyzing their heart. Also, do not touch the person when the shock is delivered. The AED needs an accurate reading of the heart. If you are touching the person, it might affect the reading. And of course, you do not want the electric shock to go through you. So always make sure everyone is clear. A common mistake is not getting good contact with the pads. The pads must stick firmly to the bare skin. If they are loose, the AED might not work correctly. If they are placed over clothing, it will not work. Make sure the skin is dry. If there is a medication patch where a pad needs to go, remove it. Wipe the area clean before putting on the AED pad. Good pad contact is key for the AED to do its job right and save a life. Another important safety tip is about the environment. Try not to use an AED in standing water. If the person is lying in a puddle, move them to a drier spot if you can do so quickly and safely. Also, avoid using it on a metal surface if possible. Water and metal can conduct electricity. This could be dangerous for you or for the person. Your safety and the safety of bystanders is also very important. Always be aware of your surroundings during an emergency. So, now you know about AEDs. They are simple to use, they talk to you, they guide you. Knowing how to use an AED can make you a lifesaver. It is a skill that can truly make a difference between life and death. If you get a chance, take a CPR and AED class. Practice can help you feel more confident. Remember, acting fast and using an AED can give someone the best chance to survive. You can do it.